Thank you. How do I advance the slides?
You can try this. If it doesn't work the first time, you have to do down over here.
Got it.
The rest of the time it should work.
Great. Thank you. So first of all, I wanted to say thank you for inviting me back again this year to speak here. I really, much of the work that I do is trying to translate the evidence base and the research that's being generated here in the US and around the world to policymakers. So it's nice for me on occasion to be able to talk about the policy work with researchers and the folks who are really doing the work on the ground. So I work for the Drug Policy Alliance. I'm the Deputy State Director for the California team, and I work in San Francisco. Just a little bit about the Drug Policy Alliance. We're a nonprofit advocacy group based out of New York, and we work in a number of different areas, public health and harm reduction, which is my area of focus, criminal justice reform, sentencing reform, and marijuana. And this is a bit more information about our organization. There we go. So just to put some things into context, and when I talk about drug policy reform, one of our big goals is moving drug use and people who use drugs out of the criminal justice system to the largest extent possible and into the public health and medical arena. That we believe that the world of public health and medicine has significantly better and more effective tools at addressing the harms related to drug use than the criminal justice system does. And so that's much of what we've been pushing for over the years. And it's a really interesting time to be doing this work, I have to say. I was talking with some folks about that over lunch. We are seeing greater popular support now for drug policy reform than we have in ages. We're seeing new voices speaking up about the racial disparities in drug law enforcement, about the challenges, the money that's been spent on drug law enforcement, so on. Increasing positive media coverage, legislative victories, ballot initiatives passing, and really interesting new movement internationally where countries around the world are trying to try different things, try different approaches. They're identifying that what they've been doing around drugs and people who use drugs hasn't been working, and they want to try new things. Certainly one of the biggest flashpoints, key points here is around marijuana, and we're at a particular point right now in the United States where we're sort of looking at marijuana differently from a policy perspective. So, you know, as everyone here knows, it's been referenced before that Washington and Colorado voters both passed ballot initiatives in 2012. Somewhat different ballot initiatives that do create different systems in each state, but the really diverse coalitions came together around this to say it's time for us to try something different. So implementation is underway in both states. In Colorado, you know, it's now not only legal to possess marijuana as an adult, but there are also places you can go and purchase it. It's certainly gotten plenty of media coverage, and certainly if you've been to Colorado in the last few months, you are probably well aware of this. The federal response to this has been somewhat muted, I think very intentionally, but continues to be an issue because obviously we still have the Federal Controlled Substances Act in place. This is still a substance that is not legal under federal law, even though it is now legal under state law. And this brings up any number of very interesting legal questions. But it's also clear that it's inspiring a wave of legislation and initiatives in other states looking at that. And I'll get into that a little bit more in a bit. So here we go. This is where the popular opinion is. This is the Gallup poll. They've been asking essentially this question about, do you think the use of marijuana should be made legal or not? They've been asking this since 1969. You can see the yes is going up, and it's going up very dramatically over the last couple of years, but it's been a pretty consistent trend. And there are a lot of, as I said, a lot of these new voices coming out saying the war on drugs isn't working and we should try something different. The Right on Crime, this is Newt Gingrich and Grover Norquist and some of these sort of stalwarts of the conservative and libertarian political perspectives who are saying it's time to reduce what we're doing to incarcerate people for drug use in particular. Here in California, Lieutenant Governor Gavin Newsom has been increasingly vocal about his support for marijuana legalization here in California. The Global Commission on Drug Policy just issued this week a really fantastic new report, and this commission includes any number of former heads of state from Latin America, from Europe, people like Richard Branson from Virgin Airlines, and then U.S. Attorney Eric Holder, who's been more and more vocal as we get farther and farther into the second Obama administration, saying mass incarceration is creating all sorts of harms for our communities and for our country, and we need to be rolling back mass incarceration. We need to be thinking very differently about how we are engaging law enforcement and using law enforcement. And in particular, he's been highlighting the impact on communities of color. But he's not alone in that. These are two books, The New Jim Crow by Michelle Alexander and High Price by Dr. Carl Hart. I highly recommend reading both of these, but Michelle Alexander in particular in The New Jim Crow, she really digs into ways in which the war on drugs has been used as a system of racial control, the way it's been used to push young men of color, particularly young African-American men, into a criminal justice history, into incarceration. And she really highlights the ways that that's played out and the impact that it's had. Dr. Carl Hart, he's a researcher at Columbia University, and he, in his book, talks about his research that he's done around substance use in Columbia, but he also talks about racial disparities and the impact that poverty had in communities of color that made them more vulnerable to crack cocaine, for example, when it came through in the 80s, and the extent to which a lot of the economic conditions that were already devastating those communities in many ways had a significantly larger impact than crack did, even though crack sort of got blamed for it, and then people cracked down on it, and people ended up in prison instead of trying to rebuild those communities in any positive way. So towards that end, we've been able to do some work trying to address some of these racial disparities at the federal level. Crack and powder cocaine were sentenced very differently for the same amount of drug. You got 100 times longer sentence if you had crack rather than the same amount of powder cocaine. That was rolled back in 2010. Now it's only an 18-to-1 disparity, which is not good, but it's still better than 100-to-1. It was the first time that a mandatory minimum sentence for drugs at the federal level had been rolled back since 1970. So we're starting to go in the right direction. We're starting to identify these racial disparities. New York Police Department's been ordered to stop their racially biased stop and frisk practices, which were picking up a lot of young men of color and shifting them into the criminal justice system. And on a couple of other fronts, one of the things that I work on in particular here in California is trying to address drug overdoses. You saw some data earlier this morning talking about the extent to which drug overdose deaths are going up, and I've got a similar slide coming up. We know that the main reason that people don't call 911 when they witness a drug overdose is that they are afraid of being arrested. Often a very valid fear. They're afraid they will get arrested. They're afraid that their friend or family member who's overdosing will be arrested. So what we've done at the Drug Policy Alliance, what some of our allies have done around the country, are get these 911 Good Samaritan bills passed that provide some limited immunity. If you call 911, if you do the right thing, if you access emergency medical services, you won't be arrested for drug possession or paraphernalia possession, and the person who is overdosing won't be arrested. So it's trying to create a legal environment to encourage people to do the right thing, or at least allow them to do the right thing, which is what people often want to do. And then Latin America has recently been really talking about this in really different and dramatic ways. Both former heads of state, current heads of state have really been raising these questions. Many of the countries, especially in South America, have really been devastated by the war on drugs, by the market in the United States for drugs coming from these countries, where the drug trafficking organizations have been able to make huge amounts of money and have put that to very destructive purposes in those countries. And so people are starting to say, you know, we need to try and do something different here. So that's all the sort of stuff moving in positive directions. But we're still arresting over 1.5 million people in the United States every year. And nearly half of those are for a marijuana law violation. And the vast, vast majority of those who are arrested for a marijuana law offense are just being arrested for possession only. So this is, you know, over 658,000 people who are being arrested for marijuana possession every year. This should be there we go. And so these are our arrests, and this is our incarceration rate. That's us at the top of that bar up there. Our incarceration rate is higher than Russia, higher than China. We lead the world in incarcerating our citizens. And in particular, African Americans bear the heaviest burden of incarceration and its collateral consequences. So 2/3 of the people incarcerated for a drug offense are Black or Latino, even though we know from the research that Blacks and Latinos use drugs at about the same level as whites do. Back on the public health side of things, we still don't have any federal funding for sterile syringe access. This can reduce HIV and hepatitis C transmission. It reduces HIV transmission by about 80%. About 1/3 of AIDS cases in the US right now are related to injection drug use. And yet we still don't have any federal funding for this extremely effective HIV and hepatitis intervention. And again, it's because of our drug laws that we haven't been able to use federal funds for that. Here's my overdose chart. This is the rate of unintentional drug overdose deaths in the United States. You heard a lot more in detail about that this morning. Here in California, in the country as a whole, more people die from accidental drug overdoses than motor vehicle accidents. And drug war violence, drug war-related violence is continuing to kill people. Mexico's drug war since 2006 has seen over 70,000 people murdered. This continues to be one of the huge costs of our war on drugs. So what exactly has changed? A lot of stuff is changing, some stuff isn't. What does it mean for drug policy reform? What's the context in which we're trying to do this work? We still continue to rely very heavily on our criminal justice system to respond to drug use. We continue to arrest people and incarcerate them rather than seeing this as a health issue. We're going in the right direction there, but it's still a problem. People still aren't able to get treatment when they want it, to get effective treatment. Popular opinion continues to be far ahead of elected officials, and we need legislative change. In many cases, the laws are what are keeping us from being able to implement effective programs like sterile syringe access. We also, however, we need to build a health response. Those of you who are involved in the healthcare system, we need to be scaling up our capacity, our methadone programs, buprenorphine programs. We need to make sure that primary care doctors are able to have conversations with patients so that patients will trust them to disclose illicit substance use. If they can't trust their doctor, the doctor may be missing something. Is legalization the answer? That's not a question I have an answer to. A lot of people come down on different sides of that. One of the things that we say in my line of work is that, prohibition is not control. It's often the absence of control. And how do we get better control of drug use? And what could that look like? Is it legalization? Is it something short of legalization? And what does a health-based response look like? What would an ideal response to drug use and people who use drugs look like? What is the best way to reduce, for example, reduce youth marijuana use? We've done such a fantastic job of reducing youth tobacco use, right? And we've got a lot in place. But prohibition, per se, of marijuana has not had that impact on youth marijuana use. And a lot of this, I think, still comes down to stigma and the stigma around drug use, the stigma around what it means to be a person who uses drugs. And it's tied to the stigma around mental health. Often there's poverty and homelessness involved. We continue to have a lot of stigma and outright discrimination around people's conviction status. If you've got a criminal justice history, if you've been convicted of a drug felony, in many states you're not eligible for food stamps, for example. In California, that's been true up until very, very recently. Just this year, California changed our law to allow people with drug felony convictions to access food stamps. But we put a lot of things in people's way here. So what's coming next? What's happening? These are a few sort of points to watch. I think the ongoing federal response to what's happening in Washington and Colorado with their legalization of adult recreational marijuana use. We've got a new head of the Office of National Drug Control Policy. He is interim. I'm certainly hoping he becomes permanent. It's the first time that we've had someone with a public health background as opposed to a police or a military background in that position. And I think that's an incredible symbolism from the Obama administration about taking this seriously as a health use. He's also a really fantastic and experienced individual as well. I take it you're... Got it. I was waiting for some signs from down there. So just a few quick things about what's happening in California. We've got a couple of ballot initiatives up here. Prop 47 on your ballot. We'll actually roll back some of our drug sentences from felonies to misdemeanors, meaning people won't be, and it's going to be retroactive. People won't have felony convictions on their record and everything that goes with. Prop 46 does a bunch of different things. Read it carefully, but it includes mandatory drug testing for doctors. So we can agree to disagree on that one. And then these are some bills that the Drug Policy Alliance has worked on. One would allow pharmacy access to naloxone, the medication I talked about earlier. It would mean that pharmacists could dispense it without a prescription, so I could walk into my corner Walgreens and get trained on how to use naloxone and walk out with it in my hands. We will almost definitely have marijuana legalization on the ballot here in California in 2016, so that's something worth keeping an eye on as well. And seeing how Medi-Cal expansion affects access to treatment here in California is really important. So how do we do better? And for me, it's how do we build up a health response? How do we put health experts on the front lines of engaging with people who are using drugs, people who have substance use disorders, people who are trying to change their drug use instead of the criminal justice system. Look at the Portugal model. I talked about it a bunch when I was here last year, but it's an interesting model that both scaled up their health access and treatment, methadone, buprenorphine, while decriminalizing personal possession, and they've seen some really good results from that. And that's it. I will stop there and answer any questions.
Sorry for rushing you. Thank you.
No worries.
Very provocative talk. Let's hear some questions.
I try to be provocative a little bit.
Just a quick question. I don't remember the number of the proposition or the bill that is being proposed, but the crack powdered cocaine disparity reduction, is that retroactive as well?
No, it's not, I don't think. And that is Senate Bill 1010, and it would address the state sentencing disparities between crack and powder cocaine. It's currently on the governor's desk right now. If you would like to see the governor sign it, please send him a note. And we worked on it with the ACLU and the NAACP and a number of other groups.
Thank you.
Sure.
I'm just asking about the incarceration rates. Is it taken into account? Is that for drug use only, number one? And is it being taken into account that the United States is bigger than some of the countries on that list?
Yeah, so that's a per capita figure. So it's takes into account the size of it, and this includes all incarcerations, not specifically drugs.
Switch the control to.
Other questions?
Okay. Thank you so much.
You're very welcome.
Thank you.